thank you so much for joining us. And for the audience, we just had a little bit of tech because it is the year 2020. So why would we not have a couple of delays and hiccups in our broadcast? So good morning. My name is Camille Cray. I am the Director of Legal Services and Public Policy at the Ohio Alliance to End Sexual Violence. And we are joined by a wonderful panel this morning of folks that provide crime victim services to sexual violence, domestic violence, and child abuse victims in the southeast region of the state. So for those of you that are not familiar with this Critical Conversation series, we are providing weekly updates to lawmakers, municipal governments, federal lawmakers, constituents, and members of OAESV and any interested stakeholder on the impact of Victims of Crime Act funding cuts across the state. So for those of you that have joined us the past couple of Wednesdays, we had an initial call 2 weeks ago with Rosa and myself to talk about the impact statewide. Last week, we had all of our regional directors, including Jen Seifert from SAOP in the Athens area, to talk about the numerous counties they serve and the impact on those regions. And then this week and the following weeks, we will be focusing on direct impact on specific programs and specific parts of the state. So the team we have today, I'm going to have everyone just share your name, your pronouns, and where you work, and then we will get started with our discussion. So I'll start with Jen, if you can share that information, then a little bit about what our relationship with SAOP looks like and folks that are joining us after that.
Perfect. Thank you, Camille. So my name's Jennifer Seifert. I'm the Executive Director of the Survivor Advocacy Outreach Program. My pronouns are she, her, and hers. And we are a dual program serving survivors of sexual violence and domestic violence, a non-residential program. And we serve Athens, Hocking, Perry, Morgan, Vinton, Meigs, Gallia, and now Jackson counties as well. So a lot of area in Southeast Ohio. And I'm one of the regional leaders at OAESV and have had the pleasure of, participating in the regional meetings and things of that nature.
Great, thank you. Gretchen, if you can share with us your position in your agency and what the type of work that your agency does specifically.
Sure. So I guess my pronouns, first of all, are she, her, hers. And I work in the Hocking County Commissioner's Office now. I've been here since January as the County Grant Coordinator. Prior to that, I was a victim advocate and the grant coordinator at the Hocking Prosecutor's Office. I started there in 2015 until I transitioned to this role in January. And so part of my job now related to victim advocacy, I don't do direct services anymore. However, I'm grant writing, obviously, but so I coordinate the VOCA program at the prosecutor's office, and we added a victim advocate through another grant at the sheriff's office. So, and I work with SAOP quite often. And we actually we're working on getting a grant going to do some lethality assessments here in Hocking County, which is definitely needed. So that's basically my role here in Hocking County. I'm kind of the, how do I say, I try to get the offices in the county to work together. So that's my role.
Thanks so much. Shelley, please share your agency and your own information with us so that we can introduce you to our attendees.
Hi, my name is Shelly Kemper. I am new to being the director, an advocate, and newly grant coordinator. You all probably knew Sita Trasco. She recently retired, so I moved into her position. So I'm pretty excited about that. We, are grant based and we serve all domestic violence victims. Any victims, we only serve Meigs County out of the prosecutor's office. So, we have, 500 plus victims a year. And we just, do what we can with what little we have. I've been working with Jennifer also because it's all new to me. I'm not even used to speaking like this. So I'm hoping that, I can get some help from you guys on what to do in the future because it's all new to me. So.
Thank you so much. Welcome. And Kelly, if you could introduce yourself, that would be great.
Yeah, hi, I'm Kelly Cooke. I'm the executive director of My Sister's Place. We are a domestic violence program serving Athens, Hocking, and Vinton counties. We have an 11-bed shelter located in Athens. We have outreach counseling that we offer in Athens and Hocking. And we have court advocacy services and a 24/7 hotline.
Thanks so much. So just for some background before we go into a little bit more about the cuts specifically, I wanted to talk about what the VOCA grant funds and what services within that realm you all provide. So we've talked a lot about the relationship between governments and nonprofits and how governments identify a need that they can't fulfill with full-time employees or agencies that are within the government. So they provide grants and contracts across the board to nonprofit agencies that have local expertise and content area expertise to provide those services. So over the past 35, 40 years, we've been developing and refining what we think crime victim services should look like and what services should be provided. And the government then within that provides grant programs with specific goals and restrictions and then picks applicants to provide those services. So you all provide, a specific type of service, and I think they're all very unique. So I want to talk about the distinction between community-based advocacy for rape crisis programs, community-based advocacy for domestic violence programs, and then really kind of hone in a bit on what Gretchen has been discussing and provides, which is the model of the prosecutor-based advocate and municipal local government advocacy. So in your capacity, you're working with folks that work for a government unit where community-based advocates are kind of standalone units. And I'm hoping that each of you can share a bit about what, the core responsibility of your agency is, so that we can highlight what it looks like when we talk about prosecutor and law enforcement advocacy, because those folks have also lost a significant amount of funding. And I think it's really important to share those differences because we're not really competing, we're all competing for the same VOCA funds, but we're doing different things with those funds. We're not all providing the same service in different ways. We're providing really distinct separately needed things. So if Jen, maybe you want to jump in and talk about what a community-based rape crisis program does, and then we can have, we can kind of go in and I'll direct each of you to answer that as well.
Yeah. So, our mission, we're an organization that's dedicated to the prevention and healing of sexual violence in Southeast Ohio. And so we provide a model of advocacy that is not only community-based, but is also mobile. So, with covering as many counties as we do, we have advocates who are based in the communities in which they serve and can activate and travel to provide services in a safe location that's most convenient for our survivors and provide transportation if needed. And so our role is, essentially all the folks who are at the beginning of a criminal justice process, and also those folks for, the many, many reasons that someone might choose not to report to law enforcement. Those are primarily the folks that we work with. Also the individuals who, might have chose not to come forward initially, but now, a few years later, sometimes 10, 15 years later, they're wanting to explore services and see what they might be able to do going forward with their healing and whatever that looks like. So we really defer to our system-based advocates when appropriate because they are the experts of that process. The criminal justice process is very nuanced and takes a very specialized knowledge. And that's whenever we have someone who their case might advance and going forward, that's when we defer to our partners like Gretchen and Shelley, to provide that services because they're the most equipped to provide that advocacy. But primarily, that's kind of the difference between our program and some of the system-based advocates.
Thank you so much. Gretchen, can you share what the role of the prosecution-based advocacy is and how that differs from the community-based method?
Sure. So the prosecutors advocates, they primarily work with victims of crime after charges have been filed, or say a report has been made to law enforcement and charges are coming, and the prosecutor's office just hasn't made that determination yet. So the advocates will go to court with the victims, and they just keep them updated on the cases. A lot of times people just don't want to go to court. So in some cases they are subpoenaed. So they just basically, keep the victim informed about the status of the cases and update the prosecutor on, what they would like to see as the outcome of the case, let them know if there's any potential plea deals. They can facilitate meetings with the prosecutor's office or at the prosecutors in the office. And they also work to collect information on restitution, so that can be ordered as part of the sentencing process. They help victims at sentencing, whether they want to give a statement or they want the advocate to say the statement on their behalf. So there's a lot of different things that the systems-based advocate does within the prosecutor's office. At the sheriff's office here in town, there's one advocate who works on the cases where there may not be enough evidence to prosecute. So we identified a significant gap in services. There was a lot of victims that just weren't having any interaction with any advocate. So we've been working to bridge that gap. So we have a 4-year grant for that. And then of course, both offices work with Jen and SAOP and her advocates in cases where, say, there's a conflict where, say, for example, law enforcement may have charged the wrong person. So it's a conflict and nobody can work with that person at that point. So Jen gets contacted, or we refer the victim to Jen's office. So yeah, the advocates also do what they can with the money that they have. So emergency legal services, I would say a lot of the funding goes towards helping hire attorneys for that final hearing for the protection order proceedings. Broken locks, broken windows, anything that provides a level of recovery support services for that individual. So in each case is different. So that's basically what the systems-based advocates do.
Thanks so much. Shelley, can you elaborate a little bit on any differences you see or any specific roles that your team fills and what you think would be lost if those positions were not there and if your programming wasn't there?
Just like Gretchen, her position sounds pretty similar to ours. We have 2 advocates and we're prosecutor-based. So we did have a part-time advocate and 2 full-time advocates, and we lost that part-time position due to the cut. But we too assist victims in court for all crimes, domestic violence, theft, any time there's a victim, we assist them. We handle county court, municipal court, juvenile court, and common pleas. We go to court with them. Just like Gretchen said, if they want to go to court, they can. If they don't, that's what we do for them. We speak on their behalf. We set up meetings with the prosecutor, things like that. We also do the civil protection orders out of our office, or we have. We've recently been working with Jennifer as well to get some help on that, because that's what our part-time position consisted of, was the CPO specialist. And now that we don't have that position, the funding for that position, we're doing them on our own in between court, and sometimes missing some other hearings because we have emergency protection orders. So it's all pretty much the same as what Gretchen said. There's just 2 advocates here, and we do what we can.
So, and I do have the same sort of question for Kelly, but I wanted to do a follow-up quick. So I'll be right back with you, Kelly, I promise. But for Shelley and Gretchen, you've talked about how you set up meetings with prosecutors, how you accompany to hearings, how you provide support and communication. What would it look like if there were no advocates within the prosecutor's office? What would that look like for the prosecutor, and what would that look like for the survivors of crime? Because I know that, I practice law, and so I see the value in having community-based advocates. I'm a civil attorney, so I don't have a prosecutor-based advocate system within my own practice, but there is a lot of specialized work that happens both on the advocacy side and on the attorney side. And so if you remove the prosecutor-based advocate from the support offering and from that system, where does that leave both the prosecutor and the survivor that they are working with on a case? Because it really is not the survivor's case, it's the state's case.
I think it would be I don't even know. It would just be terrible. So from the prosecutor's standpoint, they don't have the time to dedicate to work with survivors of crime at that level. They just don't have the time. With the volume of cases that come through that office, you have thousands coming through every year. And they barely manage to keep their head above water now. And they're dodging. It's not just criminal cases. The prosecutor's office they're the legal representative for the county, the township trustees. There's a lot of responsibility that goes into that. So there is absolutely no way that they would be able to provide that level of support to victims of crime. There's no way. They're not going to have that specialized knowledge to know where to go to provide anything. Really, at the same level as advocates. It's just impossible. So not to mention that in Ohio, we have Marcy's Law, we have the revised code that says that prosecutors' offices have to do certain things. Mm-hmm. So I'm not even sure what would happen in that case. And the county doesn't have the money to fund the advocate positions. So there's just, the VOCA cuts are just awful. So I know in Hocking County, and maybe we haven't gotten to this part in the conversation yet, but I know in Hocking County, there's 2 full-time advocates. Shelley, I think we took your part-time person, by the way. She's full-time in Hocking now.
We have filled her position, and she was in that position for a very short time, from January to now. But we have since moved her up to a full-time position, and we've lost that part-time position due to the cut. And the same with our office. If the prosecutors, we have, our prosecutor and our assistant, if they had to handle any victim case, and contact the victim and make sure they're notified before an arraignment, it would be a disaster. They just don't have the time for that. We handle all the departments here. We have the sheriff's office and 2 local police departments. And I know that some counties are able to have sheriff's office advocate, and we just don't have that. So, you know, it's so often, you know, that people are just told you need to call victims assistance at the prosecutor's office. The sheriff's office sends them here. The police department send them here. So I know that the prosecutors are in court mostly every day, all day, and to deal with the inside emergencies that come in the office and the phone calls and the letters and notification, they would never be able to do it.
Same in Hocking County. I mean, the level of cases that the advocates see every year has gone up since. I was just looking at the numbers this morning, and they've gone up every year since I've been there. And you're talking 800 cases a year between 2 full-time advocates and 1 part-time person. And when you have to send out court notices and letters for multiple hearings on each case, I mean, that there's just no way that prosecutors would be able to keep up with that volume.
Yeah, we send out thousands of letters a year, you know, and that's just for court hearings. And the phone calls are times, you know, multiple times that. I mean, we make a lot of notifications.
Thank you for articulating that. I think the common usage of the term advocate across various very specialized professions for me is always a little bit confusing, because we also call lawyers advocates too, in different spheres. And so I really like to hone in on what those different positions do and what that looks like, and what role that plays in benefiting various parties. So thank you for going into that and sharing that. And, you know, Kelly, you work with domestic violence victims in a shelter-based format. And I'm wondering if you can talk a bit, because it'll be a little bit about a shift. You know, not all survivors of domestic violence utilize shelter locations. But so far, we've been talking more about crime survivors who either pursue healing and support from community-based advocates, or are working with prosecutor-based advocates for information and support in their case. And can you explain a little bit more about your role, what your center provides? And, you know, I think domestic violence is something that we talk a little bit more about in more than human trafficking or sexual violence. But what does that advocacy framework look like, and what has the government been funding you to provide that's so crucial to your community?
Yeah, I mean, I think one of the differences, you know, just in hearing others speak, not a lot of our folks that we work with are involved in the criminal justice sphere. Like Jen said, there are all sorts of reasons why people do not want to be a part of that world. And I would say the majority of people that we have in shelter are not in the, you know, they're not pressing charges. There's been no arrest. And so definitely more of just a community support, shelter, counseling. We do have a court advocate, but really our focus is on immediate safety, providing a way forward with, you know, employment or other income through case management, finding housing, affordable housing, you know, obtaining housing vouchers. That's more our world. Yeah, trying to help people kind of make steps forward logistically when they've, you know, maybe never cared for their kids on their own. It's, you know, maybe their abuser's mom has been their primary child care, things like that. That's kind of the world that we're navigating. And then we, you know, work closely with folks like that are on this call, and with our Athens County Victims Assistance Office. So VOCA has provided funding for our shelter program coordinator, so like our house manager, for our court advocacy services, emergency funding that we use to, again, assist just with those logistical steps forward. You know, somebody needs a birth certificate, somebody needs a driver's license. So paying those little costs that, you know, don't seem like a lot, but they can be a huge barrier between a person and where they need to be. VOCA pays for our groceries, it pays for our hotline. So a lot of just our basic functioning at the shelter has been paid for by VOCA for a long time. We've been around for a long time, 1977. So yeah, I hope I answered your question.
Oh, you absolutely did. And since you were talking about groceries and cost fundings and the things that VOCA does, I'm wondering if you can share what your cut was and what that is going to take away to the constituents in your communities.
Yeah, we got cut by about $50,000, which that's a lot of money, you know, compared to our annual budget. So we are, our court advocate is going down to part-time. We have eliminated that emergency funding, hoping to make up for it with maybe some CARES Act funding, you know, but that's really just for COVID related expenses. We cut staff training, you know, just trying to kind of get by on the free stuff. You know, ODVN does a lot for us, but our counselors, our mental health professionals who access all kinds of professional training opportunities, we do expect them to stay up to date on treatment modalities. So so that's, you know, that's a concern, that those things cost money. Yeah, so $50,000 is it's a lot. We're going to do our best to try to, you know, find funding through other means, but other grant funding has, you know, become more competitive over the years. And we already have things that we, you know, cover through those grants. So it's a bit of a riddle for sure.
Can you speak a bit about, at least in my experience, we do a lot of court advocacy on the team that I manage at OAESV, and we interact a lot with referrals from domestic violence programs and sexual violence programs. And so for us, you know, for me, it's really clear what losing a court advocate, even part of their time, could mean to survivors. Can you talk about what services that court advocate provides, and what that might look like now, you know, for the amount of time each survivor is going to be able to have access to that person, what types of communications and support they might be losing?
Yeah, our court advocate helps people with filing civil protection orders. She sits with people through the court process. As an advocate, she provides legal information just on, you know, options. She's not providing legal advice, but, you know, just legal information. So I, you know, we're still kind of working out how that is going to shift. I think part of it will be over the phone, partly due to COVID, partly due to her being part-time and just needing to kind of shrink her tasks in a shorter amount of time. So that's not ideal. I think we have all, you know, kind of been hobbling along, doing things over the phone and this way. And when you're talking to somebody who has been, you know, not only traumatized, but is looking at facing their abuser in court, you know, a phone call isn't ideal. So I'm not sure. Hopefully, you know, we will still be getting to those protection orders in a timely manner. But yeah, she's just not going to be as available as she has been.
Thank you for sharing that. Jen, can you share what your agency's cut was and what you are going to have to do to shore that up and balance that and explain a bit about the impact of what that will be for survivors and the vast number of counties that you serve?
Yeah, of course. So our cut was around $100,000, constituted about 30% of our VOCA budget. And for us, we had to eliminate, like Kelly shared, any professional development. 2 days in May, it's a conference that's put on by the Ohio Attorney General's office every year, and that's a very good networking opportunity and educational opportunity. And so we had to eliminate the funds to participate in that. And we also had to essentially restructure our positions because we serve so many counties that originally we had a full-time advocate that had 2 counties that they were responsible for. And we essentially had to eliminate one of those full-time positions and utilize contract folks to cover the hotline. You know, because as a small agency, you know, there's 24 hours a day and 7 days in a week for us with a staff of 6 people. And the same for other agencies that have, you know, many more staff members. Of course, they are probably seeing a higher volume of calls, but there is kind of this unavoidable reality that, you know, there's still the same amount of hours to cover. So yeah, we had to restructure our positions, and now we have our advocates that are VOCA funded are covering 4 counties instead of 2 to 2.5, which is, you know, our advocates that are in the field, they're averaging between, you know, 400 and 800 miles that they're putting on their personal vehicles per pay period. So they get reimbursed for some of that, but just to give you a sense of the literal scale of, you know, how much our advocates are traveling to get survivors services or where they need to be for court appointments or any other, you know, we were able to retain those things, but it's a bigger stress on the 2 staff that we did retain simply because of the sheer scale. And each county is a little different in maybe how they do CPOs or the different resources that are available. And so it was really part of what our advocates do, and the very essential role is to keep up to date on all the services and changes of programs and staff turnover in different, you know, our partner social service agencies. And that's hard to do for just 1 county. Mm-hmm. And it was really hard to do with 2. And now our advocates, it's 4 counties. And it's important to have that knowledge so that when a survivor, you know, like Gretchen mentioned, every survivor's needs are different, and trying to stay up on all of that information is really difficult. So yeah, about 1/3. And, you know, we're happy that we have our contract folks, and that's fantastic, but it's kind of against our philosophy as an agency, to be frank. As, you know, being a trauma-informed agency, we want to be making moves towards full-time positions that are a living wage, that are benefits eligible. And when you have cuts like this, it's next to impossible to maintain the same level of services with that orientation. So we were able to manage the cut, but it was really uncomfortable just because of that dedication that we have, that it's really best practice to have well-trained staff that are compensated well and have realistic duties, you know, and 4 counties, that's a lot for advocates to be covering and to stay knowledgeable about and to respond to 24/7.
Absolutely. And one of the things that you said that really spoke to me is you said 24/7. You did not say 40/5 or 8/5. And I think that one of the things that feels especially difficult about these cuts is that we know that so many of the advocates, in order to meet the goals of the government funders for our rape crisis programs and to meet the needs of survivors, but just to meet the baseline of what the government was asking us to do with this money, you can't just work 40 hours a week. There's an inherent need and an inherent demand. And when you're working in a field where so much is emergency based, a lot of folks are not able to just work 40 hours. And so to cut it back even more, really, you know, when we look at, I'm not looking at a calendar thinking, okay, I have 40 hours to do this. I'm looking at a calendar, looking at it like I have 24 hours a day, 7 days a week, and I still don't have enough time to get XYZ done. And I think that's a really important thing. You know, we still have ethical obligations we have to follow and protocols and standards. So no one is, you know, flying flagrantly against the code of conduct or anything and working excessive overtime, but it is a job that requires a certain amount of diligence, and we're just not going to be able to meet those demands across all of those counties if we're stripping it back even further, because really some of the work that we're doing for free. And that I think is increasing over time, and the need is not going away, especially as, you know, Gretchen and Shelley, when they were discussing Marcy's Law and the codified obligations, somebody has to be doing that or our state's going to be out of compliance. And so what does that look like? And so Shelley and Gretchen, can you share what your agency's cuts were? I know we already discussed that there's a part-time position that's not going to be filled, but how much sort of human power, worker power did you use or lose, and what other resources did your team lose with the cuts?
With mine, we lost about 22,000. Which was the part-time position, and other things like the travel, the expenses, trainings, things like that. So I've tried to cut what I could without affecting, you know, the victims too much. But, you know, our part-time position was our CPO specialist, and you know, even when we do still have civil protection orders that do come in that we do have to take care of, but it just made it easier with that position, because when we were in court, we knew that there was someone here that could help, you know, our victims when they came in and needed the help. But when it was slow with the civil protection orders, that position also would, you know, stay in the office and take care of you know, phone calls and getting messages and other things like that. A lot of times we, you know, may be over at the courthouse because our office is separate from the court, you know, and we would like to have that position here in the office to be available. We're not going to have that, so it'll be a little bit of adjusting. But yeah, I mean, it's affected our office, but we're trying to make it work.
In the Hocking prosecutor's office, we had a $76,000 cut. So what that looks like is everything has been cut except for staff personnel, and the funding that we have for that. We went through a transition earlier this year where a longtime advocate, now she moved. She's the advocate over at the sheriff's office now. And another advocate was moved to another grant program. So we had to replace those positions. Those are still full-time positions, but they had less experience. So they were hired in at a lower rate than the previous, more experienced ones. And they also didn't require health insurance. So we were able to have savings there. Our part-time advocate, who also works as our volunteer coordinator, is still there, but we don't have funding for her the entire year. So we're $10,000 short. So she's still there though. And we do receive a little bit of funding from municipal court. We get $5 per case that goes through the municipal court. That is about $10,000 to $15,000 a year. So we've had to strip everything. The only supply funding we have is already spent. So it just on ink cartridges alone. I mean, it's just ridiculous. We have a little bit of funding, reserve funding, to provide emergency legal assistance for CPOs, but advocates have been advised to use other resources first, whether that's SEOLS, the law program. Those are the two primary ones, where before it was just easier to get invoices from attorneys if they didn't apply for the crime victim compensation program or weren't eligible for funding through that. It was just easier for me to get an invoice and pay it outright. I mean, it's done, it's just a lot easier. So yeah, we don't have funding for emergency services. So if somebody has, I don't know, like a broken lock, or, their door gets bashed in, their window gets broken, it just may have a board across it for weeks now, because crime victim compensation takes a few months. I mean, and here we are getting close to winter. So yeah, everything's been cut. And the advocates that are working at the prosecutor's office now are eligible for county insurance, which is going up every year. It's good insurance, but it's also expensive. Now, we've been fortunate that they don't need it. They haven't requested it. However, that could change. I mean, at any time. So our open enrollment is coming up. So who knows what next year is going to bring. I mean, it's just, yeah, I have no idea. And we have a new prosecutor starting in January. So there's always that weird transition time too. So, and he's walking into all of this. So.
Thank you for sharing that. And I think it's so important when you were mentioning the very specific example of a board across the door, that this is a human cost. We're here for a reason, and you all are providing really important services that if they are not provided, people are going through something they didn't plan for, that no one wants to go through without the support that we've cultivated over several decades in Ohio. And I want to go a little bit into, planning for the future around this. VOCA has been a funding stream since the 80s. And so it's become what I think is it's like a partnership. It seems less like a grant you apply for and more like a sustaining partnership that's been here for decades. And Kelly, I'm wondering, you touched on this a bit, but planning for the future, especially amid COVID, we know that domestic violence, intimate partner violence is increasing. You have an 11-bed shelter. You took a $50,000 VOCA cut. How do you plan for long-term? I'm assuming that, you're looking at this as there's never going to be a decreasing need for advocacy for domestic violence survivors, especially in the middle of multiple pandemics and funding reductions. So can you share a little bit about, and you may not have a long-term plan yet because this was just announced, but what kinds of thoughts and development issues have come up on your end when you're thinking about how to meet the demands of a problem that is being exacerbated under current circumstances, with knowledge that the long-term government funding partner is backing out, essentially, not fully backing out, but is not able to participate to the same degree that they were before?
Yeah, you're right. I mean, unfortunately, we never see a decrease in need. Over the years, our average length of stay has gotten longer. The number of people that we've turned away from shelter has gotten longer. I think those two are related. We get kind of a traffic jam in shelter. You know, and I think part of that is, you know, maybe that people are more aware of services, that maybe there's a little bit less of a stigma. I don't know. It's hard to know like why all of that is happening. Affordable housing is such a difficult thing in our area. In Athens, Ohio University really kind of artificially inflates our rents. Housing costs in Athens are actually higher than they are in Columbus. It's just crazy, and it's a very poor county. So I don't know. I mean, these are the things I think about every day. We are trying to think about doing some sort of transitional service so that folks have a place to go once they really are not in immediate need of emergency shelter anymore, but for whatever reason are not quite ready for permanent housing. Maybe they're just waiting for, you know, to find an affordable place with a voucher or something like that. That's kind of what we're focused on right now, is trying to keep people moving through the shelter so that people who really need it, that there's room for them. So I don't know. I mean, things like VOCA cuts really kind of can throw a wrench in those plans too. You know, if we have to go to other sources of funding to cover the things that just our basic operating costs, that really leaves less of an opportunity for us to move forward on plans like that. So I don't know. There are a lot of question marks right now. You're right, during a time that people just need us to be there and be available and have a full range of services. Yeah.
Thank you. Thank you. It's when you look at what is available, like you said, this is not decreasing. The demand is not going down just because we can't match federal dollars adequately to the need. So this is sort of a question for all of you. If you're looking for alternative funding streams, you know, sometimes we really have to put our what is possible caps on, and sometimes that leads down roads where you hit a dead end and you think, okay, we can't do that. Is it, in your mind or your opinion, appropriate for social services that have been deemed essential for decades to be funded by out-of-pocket fees, so heavily on community donations? You know, normally we think of tax dollars as being a heavy payer for things. You know, we have tax dollars that pay for sidewalks and stoplights and road construction and all kinds of other things, drinking water, things that we all collectively use. And I don't know that there is enough public discourse around thinking about this service is something we all collectively use, but these issues that we're serving affect everyone, and they're things that need to be addressed. So in your mind, are there other, besides, and the VOCA grant, just kind of, I think we talk about this a lot, but I don't think we prefaced it in this specific this specific broadcast, is that the VOCA grant is not taxpayer dollars. The VOCA grant is funded by white collar, mostly federal crime fines that are paid into a fund. So it's fines paid by folks who have been convicted of certain crimes and other civil lawsuits pursued by the DOJ. So damage awards for that gets distributed to crime victim service providers. So it is not something that is being issued from tax dollars. There are other grants that are taxpayer funded. This is not one of them. So when we are talking about cuts and needing to increase our asks, that does not equate within VOCA to we need people to pay higher taxes. That's not what we're talking about. So taking that aside, other than possibly increasing taxes on local communities, state citizens, or the federal taxes, what are ways that we can justify doing this? You know, when I think about fee-for-service models, that doesn't seem appropriate at all, to be paying folks or having folks pay because they happen to be suffering from this public health crisis. And I'm wondering if you have had any thoughts about what might be appropriate, or if going back to the federal government and saying, this is a service you have deemed necessary, you need to increase that fund again or increase the drawdown for VOCA. What are the thoughts that you have all had about that as we're scrambling to figure out how to keep providing these services to people? I know that's a very loaded question.
No, I'll take a stab at it. So, for us as an organization, what it really comes to is that most other sources of funding, you have to propose new programs, right? You can't engage in supplanting and essentially get new money to provide the services that you've been providing. And what these cuts really translate into is diluting the services that we're providing, is you essentially have to just figure out how to do more with less. And that it has to impact your staff and then ultimately the survivors. And, the fee for service models aren't fantastic. I mean, one thing that we've been exploring as an organization is like a social enterprise or a social justice enterprise model, where we figure out how to generate revenue via other mechanisms. And we're just very kind of early in those discussions of what that might look like. But the unfortunate part of all of this is new programs, new models. It takes more of what I like to call the administrative underbelly of an organization. You have to have someone that's there that's providing the stability and the organizational capacity for your folks to be out in the field. And if that isn't funded properly, again, it's going to be one of these second order effects. It's going to impact your survivors and your staff. And that's what I really see is, taking on more of these, even if they're particularly creative, like a social justice enterprise, that takes more staff. New programs takes more staff, more people to administer these things, which, it's just really hard for that not to translate into impacting your staff and then the services that you're providing. So the thing about VOCA is that it came with this kind of comprehensive support. As a funder, they would let us, the Attorney General's office would let us direct bill things that many funders wouldn't. Support for, say, a financial audit that's required of a lot of nonprofit organizations, or utilities or other things that are typically captured in indirect costs. Our VOCA funders realize that those things are absolutely imperative, because it's your staff have to have an office and a computer, and they like electricity and a toilet that flushes at their office, right? And VOCA was always really progressive in understanding that those were also essential costs, but that's what's getting lifted out, because I think a lot of organizations are prioritizing the direct service aspect to try and really minimize this impact on the services. But yeah, if you short yourself in that administrative underbelly, makes directors or leaders of organizations like the ones here, in this conversation, it just gives us more work to do, and adding programs and finding that's more, on top of what we're already trying to do. So yeah, it's like Kelly said, it's a riddle.
Yes. You make such a good point about the project base. When you're looking for new funding, you can't duplicate services. That's just a standard. And so, we've seen that a lot where we think about applying for a grant, but we see what that would add to the plates of already existing staff members and how that would reduce time for direct services. And we can't end up asking for the funding because it would just make things worse for survivors rather than making it better. So it's not always about the budget number. It's about what in your budget, like for every dollar you have, what are you responsible for doing with that dollar? And anything that's not direct service to survivors under that dollar does get a little bit complicated as well. But I agree, the value of administrative services, I think, is something that is undervalued in some of these funding streams, because it does allow folks to focus whose job is to focus on survivor services. But now I'm just going on a soapbox. So, but did anyone?
And I did want to just add too, just because you mentioned it, is a lot of these other funding streams also are reimbursement grants, which means that you have to have at least, sometimes 3 months of cash on hand that you can sink into this reimbursement model. Mm-hmm. So it's often, people used to laugh because they'd be like, oh, you need more money. And I'd say, well, we can't afford that grant right now. And they're like, well, what do you mean we can't afford that grant? And I'm like, we don't have enough cash, because you have to spend to then get reimbursed. And that's really, cash flow is a big concern for a lot of nonprofits. So even if there are other projects, you have to have, so those donations that you get, you can imagine how hard it is to talk to a donor about, donating so that you can get a federal grant, so that you can essentially just have that cash in a reimbursement, locked up in the reimbursements. So
could I have one of you, because you mentioned something that struck another thought, explain what the federal match requirement is and how that can also impact decisions. I think especially in counties with lower population density, at least in my experience, it is much harder to galvanize the fundraising that you would need. So I can briefly explain what the match is, but for grants like VOCA, you can apply for a waiver. But essentially, for every dollar that you receive, you have to meet a certain percentage of that dollar with either cash donations or in-kind donations. And so it can be difficult, especially in COVID. We've experienced some issues with, normally we would have a volunteer come into the office and do things that are beneficial for survivors, or physical tasks that take a long time for our staff to do. With COVID, we can't have volunteers come in. And so we're having to do a lot of legwork to prepare projects. And volunteer recruitment is a little bit more difficult, but also getting cash donations in the middle of a financial crisis is a hugely problematic proposition. So I'm wondering if over time you can talk about how that match requirement may have impacted your decisions to apply for grants. I know that in some cases it can be a hindrance, because if you know that you have to come up with X percentage of dollars for this amount of money to get, you're not going to apply for that grant. Are there sources that you've turned down or have had to think about turning down for any of you? The question is for any of you because of that match requirement.
Well, I know on my end, when I look for grants, I tend to look for the ones that I can draw down. And then where we say if we can subcontract out with an agency and they have the reimbursement funds, that's always helpful, because then they provide me the invoices and then I do the drawdown and they, send them the check. But again, I mean, the agency that's providing those direct services still has to have the reimbursement funding in place prior to that happening. So, I mean, for the VOCA program at the prosecutor's office back in, I think it was 97, maybe, that's when the judge in municipal court made a ruling that $5 from every case should go towards the victim, into the VOCA fund, the county VOCA fund, which has been great, because that helped with the match requirement for a while. And then when I joined in 2015, we got a waiver with the big, influx of funding that came through in 2015. So we got a waiver for that. And since that time, we've added volunteers. So it's a partial it's in-kind match, but it's partially waived too. So it's manageable, but the flip side of that, though, is we had to hire a volunteer coordinator to manage the volunteers. So, it just goes hand in hand. So I guess it would be helpful if the federal government continued pursuing and prosecuting white collar crime. That would be helpful. And if the state of Ohio could wave its magic wand and just appear funding to help the SVAA fund, that would be helpful. That's also something that's been cut for us, at least for the past 2 years. So yeah.
Great.
Very complicated.
Sorry.
I just said it's very complicated and it's a riddle, just like you guys said.
Yes, yes, it is. And I think it's so important. Like you said, the SVAA fund has been cut for the past couple of years. So we are, with Marcy's Law, in this conundrum where we have additional services we need to provide. And this more falls on the prosecutor-based programs than anything else. But you all receive VOCA, and those VOCA cuts have sort of left this deficit, but we have this enhanced need to be in compliance with our state constitution, and that is the biggest riddle. And it does need, I think, to fall not just on the programs that are providing compliance services, but everyone involved in the state government needs to be making sure that the proper funding to provide that compliance service is there. So it shouldn't just be falling on the recipients to make sure the state is complying. It needs to be on, you know, everybody at that level together to make sure that there is sufficient funding for your programs to be providing those services. So I've had you with us for, I'm realizing, an hour and 20 minutes, which is a very generous gift of time, especially amidst the COVID and the cuts and everything that you all have going on. So I want to open the floor if each of you has, you know, any last closing asks. We do share these broadcasts with the lawmakers in your district, and we send them to the federal lawmakers as well. You know, other than what you've already shared, do you have any last comments that you'd like the decision makers that have the power to increase funding, what would you like them to know moving forward in the next year?
I would just like for them to know that no one asked to be a victim, and it happens to everyone. And I think that until you're in that position, you truly have no idea what that victim goes through. You can hear from outside people, you can hear the stories and experiences of other people, but until you've lived that yourself and you felt that way, you felt traumatized, you don't truly understand it. And no one asked for this. And the advocates are important because they help victims of crime navigate the system. That's very confusing. That's what I would want them to know. That's why the funding is so important.
Thank you so much, Gretchen.
Yeah, I mean, these services are overwhelmingly, you know, supported by our communities. Our communities expect us to be here and expect us to be providing these services, but we cannot do it without the funding. So, and I do think that there are ways of replenishing the VOCA fund. You know, I think maybe a little creative problem solving can fix this. So I would just encourage lawmakers to figure that out. You know, I think that additional streams can be sent VOCA's way.
Thank you, Kelly.
Yeah, I can just add, you know, being a survivor is extremely costly to our communities and to individuals. And it can be more costly when individuals experience untreated trauma or don't get the services that they need. And providing adequate funding to prevent and respond to sexual violence, domestic violence, really any type of trauma is actually better use of funds than responding after it has occurred. You know, so it might seem like these asks are enormous, and especially in a time of scarcity, it can be even more difficult. But this is one of those situations that it's going to cost us no matter what. And it sounds icky to talk about someone's trauma in dollar signs, because that is just uncomfortable thing to think about, but it's a reality and a way that we can have a conversation about, something that might not compel someone to act based on, not wanting others to experience trauma. It's actually more fiscally responsible to provide better services and prevent the violence before it ever happens in the first place, for the cost that gets exacted on the survivor, their family, and the community more broadly. So it does feel like a big ask and maybe painful, but ultimately there's savings in the end, and savings not only monetarily, but in the trauma and re-traumatization of people who have experienced these life events that, like Gretchen mentioned, no one asked for. They don't want to be here, right?
Yeah, I agree. Also, being the bearer of bad news to our survivors and our victims, and with, we have the responsibility of telling them that this is all we can do, which isn't fair when it comes to funding. And, we don't have a shelter in our area, so we do refer to my sister's place. But, sometimes, just having some extra funding to put them in a hotel if need be, or get them a ride somewhere, or give them gas money so they can go to their mom's house, 2 counties over, things like that. We do need that kind of funding, and that's what we're lacking.
Thank you so much for sharing that, Shelley, and for all of you for being here today. This is a riddle. I think that's the word of the day, but it's a very consequential riddle. And so, for us, we're urging lawmakers to increase the domestic violence line item, the SVAA line item, the rape crisis centers line item. It's not the perfect long-term solution, but if we're going to make it, keep all of our programs doors open and serving victims until the next federal VOCA decision is made, we really need those supports, because, as you all have said so eloquently, no one plans to be a victim. And this is a service that needs to be available for folks when they are victimized. And if it's not there, then we are going to experience even more costly and more harmful losses for Ohioans across the board. So this is something that needs to be funded in full, and it needs to be sufficient to make sure that the people who we serve, which is anyone and everyone at any time, does not feel the impact of this cut. We're trying to shield them from that, but we can't do that with such major reductions in funding. So thank you so much. We are available at OAESV at any time to provide any information and support. And we hope that any viewers today who have joined us and have questions will reach out to us at info@oaesv.org. So thank you so much, everyone, for joining, and have a great afternoon.
Thank you.
Thank you, Camille.